5, 4, 3, 2, 1.
Here at the Connect Show, we strive to introduce you to interesting people, wonderful businesses, and I'd like you to welcome Dr. Leena to the show. Dr. Leena, thanks for joining us here today.
Thanks for having me, Judy.
I just love that you have a different and a unique business here in Southwest Florida. Most people take their dogs or animals to a clinic, and you've given us a new choice to be able to just call and you can come to us. That's a great new business.
Yes, what we have is a mobile veterinary clinic in Lee County for dogs and cats primarily, which it's the only kind of business that's the kind in Lee County.
That's fabulous.
And it's really convenient for the pet owners.
That is. But let's start with, when did you become a vet? Give us a little background if you would.
I graduated from vet school in 1995 from India.
Okay.
And that was a 6-year veterinary course. And then when I came here to America, I did a 1-year internship at the University of Florida Vet School in Gainesville.
Okay.
And also has to write all the board exams that all the other students had to write and the state boards and get licensed here. And I got the license in 2001.
And when did you start practicing here in Lee County?
2004.
Okay. Super. Now, I know every little kid dreams of becoming a vet. I know that was one of my childhood dreams. I wanted to become a vet. So what was it for you? Why did you become a vet?
In India, when we grew up, we usually have a lot of animals, every household.
Okay.
That we have our own cows and goats and for milk, that we milk them for the milk
so
purposes.
A real farm.
Yeah, kind of. It's individuals, that we needed to sustain to have milk and all that. So I'm so much used to handling animals, and always every household has a lot of dogs and cats and all that. So interacting with them was really easy for me, and I could interact with them and they would listen and do what you want them to do for you, and that I could handle them better and got very comfortable with them, and I could the veterinary part is I could treat them and make them better too. So that's how I ended up being a vet.
That's wonderful. So it's just a natural gift that you have.
Yeah, I think
with
so.
Animals.
Yeah, I think so.
Good. I believe it. Now, I know prayer and faith is a huge part of your practice. Talk about that. I think your parents were strong in the Lord?
Yeah, both of my parents are very strong believers. And I have seen them go through tough times and not give up and pray really hard and go through it. And I grew up in that environment ever since I was young. And there was no question in our home that God won't be there with you. It was always like God will be there for whatever you want. It was like a everyday life for us. So I never questioned that God cannot do anything, or He will do everything for us. And that's how my faith got strong. And when I grew up, it still stayed with me. And when I treat the animals, what I do too is we pray as a family every morning before we go out the door. And I tell my kids, don't leave the house without asking God to go with you. And I pray for my patients every morning, because we are humans, and I do surgeries every day, on a regular basis, and we put them under anesthesia. Things can go wrong, and mistakes can happen, and only God can keep me from making mistakes.
I just love that.
And I pray for my patients when I treat them for their healing, and then give it to God. And
imagine if every doctor out there started their day like that, inviting God into their day.
Yeah, and I really, when I get a complicated case, I don't really worry or panic. I do what I can, and I prayed already for the patient, and I'm praying for them, and if it's God's will, they will get better. At least I didn't make a mistake.
Right, that's wonderful. What a great added feature that people get when they have you come out to take care of their animals. Yeah. So now I know you worked in other clinics here for many years. Why the mobile clinic? How did that come about?
Well, most of the veterinary clinics, any county, Lee County or Collier County, they don't do a lot of house calls because they don't have the time. Their appointment slots are filled. Every 15, 20 minutes it's filled. House call takes on an average 1 to 2 hours of your time to go to the house, treat the pet, and come back. And it's not really worth their time to do that from the clinic. So I have seen that clinics doesn't do much of a house call, but there's a lot of pet owners who really need the service. Older dogs cannot get in the car. Cats really freak out in the carriers. So there is a big need, and that is a need that I thought I could fill.
And I think you shared with me you saw it in a magazine, a truck, or?
Yeah, I wanted to do a house call service for dogs and cats primarily, but I did not want to go just in a car with a cooler with the vaccines in it and then just give the shots. And then if the pet has, it's limping or ear infection or skin infection, I cannot diagnose because I don't have the equipment if I go in a car. And some of the house call vets that they do is, they treat thinking maybe this is what it is, or like a half a medicine.
So they're not able to do the full exam?
Yeah, it's not a full medicine,
Okay.
And I really wanted to do that. I just wanted all or none, Either I'm going to do all of it or I'm not going to do it. So I was reading one time in one of the veterinary magazines and saw a picture of a big mobile clinic, and I didn't know it ever existed. So I called them and asked them, what is it? So they told me it is a full clinic set up with surgery tables, dental tables, x-rays, everything. It's a big RV, 27-foot long.
So it's a 27-foot long RV.
Yeah,
and you're
custom
kind of a
made.
little lady here.
I'm big enough.
So you maneuvered around town without problem.
In the beginning, it was a little bit hard. Backing up was a hard thing because you cannot see the back. So I installed a backup camera on it so I can see in the front what's in behind, because I didn't want to hit the mailboxes and when I back up. So that helped a lot.
Sure, that's not maybe good customer service
No,
there.
no. Or if a pet is behind us or a kid.
Absolutely.
Yeah.
Absolutely. Now, you touched on a few the reasons why people might need you to come out to their house. Why don't you expand on that?
There is a big need in every county, every place, for a full-service house call vet. What that means is there's a lot of cats that, as pets, are sitting around in the household, didn't go to a vet average 3 to 5 years. And cats need vaccines every year. And because the cats are poor travelers, they don't like the carriers, they pee in there, they cry all the time in the car.
They have
owners
sharp
doesn't
nails.
take them. Yeah, owners don't take them.
Okay, so it's a
So
challenge.
the house call, it really is helpful because we go park right in the driveway and we give the client the choice, pet owner, do you want us to bring the cat into our mobile clinic or do you want us to come in the house and take care of it? Whichever they prefer. So the cat is just like at home. We see a big difference. Sometimes we see owners tell us that the cat is a man-eater, that's that aggressive in the clinic. But when we go in the house, they're just purring, and we're done in 10, 15 minutes.
So it removes the stress on the
and
animal.
the cats doesn't
and the
know.
owner.
Yeah, and the owner, that's the thing. And multi-pet household, I have clients anywhere from that have 10 cats, 10 dogs. It's a convenience.
Right.
Multi-pet household, cat household, large dogs that who are older, that doesn't want to get in the car anymore, limping, painful joints, or the dogs that shed a lot, like German Shepherds, get a lot of hair in the car and people don't want
Keeps the car clean, you can come out. It
yeah,
is
and
very
plus they're
convenient.
going to work, after the vet visit, then they're covered in hair, so they don't want that.
Right.
Or aggressive dogs, or skittish. They don't do well in the lobby in a veterinary clinic. They do very well with us.
Ah, that's interesting. Never thought of all those different reasons, how you meet that need. Now, what type of services do you do that are you able to do in the clinic?
we do all the vaccinations cats and dogs need, rabies, distemper, borrelia, anything else, influenza,
Okay,
all
so
that.
traditional vaccines.
Yeah, we do blood works, heartworm test. We do fecal exam. We have a microscope in the truck.
Okay.
And we send out the blood to the lab after we draw it, and they're like big blood works. We have an anesthesia machine in the truck, so we can put the dog or cat under anesthesia and do the teeth cleaning, minor extractions of the teeth, spay neuter, tumor removals, laceration repair, any kind of surgeries.
So you do actual surgeries in the truck.
In the truck.
Wow,
And we
that
also have
is
an X-ray machine
convenient.
too. Yes. And that is one thing that the clients really like, because they are right in their house and we are parked right outside in their driveway, and they know their pet is right there and not left in the clinic.
And it's the
for
same
surgery.
sterile environment that they would
Yeah.
find.
Autoclaved, surgery packs and scrubs and everything, it's the same.
That's
Gown and, mask and hat and all that.
What are some common surgeries you might do on pets?
Spay and neuter is basically the big one. We
Okay.
do a lot of tumor removals, some bladder stone surgeries. I have done enucleation. That means one of the cats we had was a ulcer in the eye. The eye had popped,
Ooh.
so we had to take the eye out. It's kind of gross, but
Good you were there.
yeah, we did that. So any kind of just regular soft tissue surgeries. I
Okay.
don't do orthopedics, no bone surgery, because the rehab is longer. So they have to be at a clinic or a
Oh, to
specialist.
stay, right, that
Yeah.
makes sense. Okay. And then the teeth cleaning, what's involved in that?
We first, either we already do the blood work at the first visit, draw the blood and send to the lab, or we do the blood work right on the day of the visit and put them under, put an IV catheter, give the anesthesia IV, and put a tube in the throat, just like in the clinic, and hook them up to a gas anesthesia. And we have this dental scaler and polish.
And how often I don't know that I've ever had my dog's teeth cleaned.
It is not very common, but we recommend if we see that they need it. And sometimes it's like, they're painful to eat, or there's a swelling, or the tooth is really rotten that
Okay.
needs it. So, but anybody who would like us to do it, we'll do it.
Okay, so that's convenient. And then the x-rays, let's talk about that. So you have a full ability to do
Yes.
x-rays?
Yes, that's the only mobile X-ray in Lee County for dogs and cats that's incorporated in Lee County. We have an X-ray machine that's installed on the kind of the ceiling of the truck, tied to the beam so it doesn't swing when we drive. And
That would be important, yeah.
It's very important. And when we need to do the X-rays, the patient will be on the surgery table, right? That's where we have the patient stay. And the X-rays goes on a track, and it comes right above the patient, and do the X-rays. And the film, it's erasable, so it goes through a processor, the X-ray processor. It's computerized.
Okay.
It's more like a digital.
Oh.
And it pulls up on a laptop. And we can see the X-ray coming up from the processor to the laptop, and can diagnose whatever the problem is right there.
Oh, that's
And
convenient.
usually the client is sitting right next there in the seat, and I show them what I see and explain what it is. And I email a copy of the X-rays to the client's email too, so they can have a folder.
So they have
with-
it right there.
Yeah, they have it right there, and it really helps the diagnosis right there and the treatment, so we don't have to
And
wait.
I think earlier you had shared that sometimes other vet clinics have you come out to do a mobile x-ray?
Yeah, I get referrals from other veterinary clinics just for X-rays.
Just for x-rays, okay.
Because maybe they have a cat that's not nice and it needs an X-ray of the chest or bladder or whatsoever. So we go to the house, and we usually have the owner kind of hold the cat a little bit before we do X-ray, so that way the cat is not stressed much. And within 5 minutes, we can take 2 or 3 views, and I email one copy to the client and one to the veterinarian who referred it, so they can diagnose, treat. So I'm not taking the client or patient, it's just doing that for them.
Right, that's very convenient.
That's very convenient.
Now, how about any stories? I know you shared a funny story about a large dog that you have, the bull mastiff that you treated.
Yeah, we had a few weeks back, got a call from a client saying the dog is limping and think it's a bone cancer.
And this is a huge dog,
Yeah,
right?
it's a 150-pound
Okay.
mastiff and limping. and think it's a bone cancer, but they wanted x-rays just to confirm it, how bad it is. So we went there, sedated the dog right in the driveway, and rolled her over onto a stretcher and brought into the truck, because the dog was not very nice with people. So got her on the table, did the x-rays, and the client was just right there, and I showed her it's not bone cancer, it was nails that you could see in the knee.
An actual nail.
Yeah, metal. And the owner had no idea
Oh,
how
the
it
poor
got there.
dog. My
Yeah.
knee hurts just thinking of it.
But it's not bone cancer, so
Right, so that
the
was good.
prognosis is a little bit better. It's not a cancer, it's a nail. Who knows how long it was sitting there, but we have a diagnosis right there. So, and I gave another shot to the dog and to reverse the anesthesia, the sedation, and she got up and walked. So
That's great. So you were able to remove it?
It's up to the owner.
Okay.
I won't do it because I am not able to do those surgeries. So I gave a orthopedic surgeon's info.
Okay.
We refer to specialists, whichever that we cannot do. So it's up to the owner at that point.
Dr. Leena, one thing that I love about you, you shared how you always tell the patients what the dogs or the animals need, but you don't force them or guilt them into treating that.
I don't. When we see patients, most of the time they are overdue. You know, multi-pet household or cat sitting around, or older cat, 12 years, 13 years old, drinking more, you know, whatever reason. And I look at the patient, we do an exam, and I kind of tell the client what the patient needs. You know, if it's overdue for rabies, distemper, blood work, here is what your cat needs. And I let them decide what they want me to do.
Okay.
So there's no guilt factor
No
there.
guilt.
Let me know what you want me to do.
You are definitely a rare treasure in Southwest Florida, and thank you for being on the show, and thank you for all that you do to serve this community.